Welcome, everyone. My name is Dr. Russ Court. I am the lead physician of Dr. EMF, and I am here with the love of my life, Jonette Biebensheimer, who is our lead scientist and brilliant. Tonight's going to be an amazing night, so I'm so excited to get this rolling.
All right, why don't we go ahead? Jeff, would you mind please reading the disclaimer?
Absolutely. I'll just pull you guys out of the spotlight for a moment, and I will do the disclaimer.
Thank you, Jeff.
You're welcome. Just follow along with me as I read these statements and comments have not been evaluated by the Food and Drug Administration. This information is for educational purposes only and includes information on recent advances in research on micronutrients. Engage, the micronutrient company, does not claim that our products diagnose, treat, cure, heal, or prevent any disease or injury. Engage's products do, however, address our deficiencies and provide our bodies with the nutrition we are lacking. Nothing here is intended to be a substitute for treatment or a visit to your primary healthcare provider. So, there you go.
Thanks, Jeff. All right. You want to go ahead and introduce our very special guest tonight?
Well, we do have a special guest tonight, Dr. Kedar Prasad, and why don't you pull up his accolades and I will read them.
Absolutely. And we're so happy to have Dr. Prasad back. Welcome back, Dr. Prasad. Go ahead, sir.
Dr. Prasad was a professor at the University of Colorado School of Medicine for more than 30 years, and he was the director of vitamin and cancer research. In addition to that, he was the president of the International Society of Cancer and Nutrition in Europe.
No.
And he's also a member of the British Society of Medicine.
London.
And Dr. Prasad was invited to be on the nominating committee for candidates in medicine for the Nobel Prize.
In 1982.
In 1982. And in 1963, he graduated as the first PhD radiological biologist in the world, a 7-year program that he finished in 3. He's been awarded 7 U.S. patents on micronutrients.
And many more coming.
And he discovered the anti-cancer potency of vitamin E succinate, as well as the anti-cancer agent of butyric acid. In addition to that, Dr. Prasad has co-authored or authored more than 32 textbooks, and he has published more than 250 peer-reviewed articles.
In very prestigious journals such as Nature and Science and so many more.
And if you look him up on PubMed, he's listed over 450 times.
I think it's more than that now.
That's what I said, over 450 times.
So welcome, Dr. Prasad.
Thank you, Jonette, for, as usual, every Tuesday I enjoyed having this opportunity to talk about aging and age-related problems.
And the last 2 weeks, I was very prepared for you for the omega-3 call when you were on your travel. And, it was an exciting call because I got to share, our experiences. But tonight we get to really talk about the omega-3 daily product and then your core 4. So I'm very we've laid the foundation the last couple weeks on the endocannabinoid system and essential fats and deficiencies and some of your experience, Dr. Court. But I think it's going to be really fun tonight to get to hear from you. And I know it's been a long time coming, but why don't we go ahead and pull up the schematic real quick for the Optimal Longevity series. And I also, Dr. Prasad, took a course this last week at UC Boulder. I was accepted into a program for sleep and circadian health. And so I was doing that work, and you know what? Everyone was talking about health span. So it was really exciting. So we'll pull this up. And, I think Dr. Prasad is just such a great example of what a good health span would be. But your lifespan is how long you live. And that's the top part of the graphic. And so many people in the United States, but around the world, have so many age-related diseases. But your health span is how many years you live a healthy, vibrant life.
Yes.
We really want your health span to equal your lifespan. And that means you're able to do many things, to be able to think, like you said last week, 3 weeks ago, think, being able to walk, talk, to be able to assimilate food, to be able to heal. All of those things are metrics we look at for a healthy health span. But what about like just being able to go on vacation to the Hamptons like you were, right?
Yeah, that's
Or
right.
to be able to do the things we love. And
Or
that's
learn, the ability to learn new things.
And you continue learning every day.
That's
We talk
right.
about that. So
Exactly.
one of the things for people on here to know that with cognition and thinking, Dr. Prasad looks up words and concepts and new research every day, because when we read papers, there are certain words that we don't know and we have to go and look them up. And
well, you know, Jonette, this weekend, Lonnie and I were at an event in a state park, and it was a big event for the Native Americans and Wyoming Days. And we were sitting there, and I was explaining to Lonnie about how the frontal lobe, this part of your brain, can actually go into demise, and we can have issues with our memory, and it can be linked to our arm swing. And we got to watch hundreds of people walk by our booth as we were sharing Micro Daily with them with no arm swing whatsoever. And I was like, look at this one, look at this one, look at this one, look at this one. And it was really shocking to watch all the people who were walking around, you know, almost like zombies, where they were just, you know, head forward, arms hanging down, and no normal gait.
so gait and being able to walk is really an important skill that we start losing when we lose frontal demise. And so we have strategies for that. So even though the people are on here tonight that maybe have problem with balance and gait, that are micronutrients and thinking and cognition, this is going to be a great call for you.
And we tried to put this in as many bodies as possible.
Yes, you did.
So it was good.
Yes. So tonight, after we showed that slide, and it's really important, and as we're both pushing 60, you know, like we say, 60 is the new 30, Dr. Prasad.
Yeah, right, exactly.
If we could recap the tale of two defense systems. That's what I kind of was laying the foundation for them 2 weeks ago. Can we talk about the antioxidant defense system and your body of work? And then we'll segue into the endocannabinoid defense system so that people understand at the highest level with these two systems, how they work and crosstalk. And then we'll just start walking into some of the omega-3.
And how the omega-3 actually works with the endocannabinoid system.
Yeah, he's gonna get us there.
I'm not going to tell him what to do. Go ahead, Dr. Prasad.
No. I welcome your advice. No, as you know, that antioxidant system has a two component. One is antioxidant enzymes, and another one is antioxidant compounds. An example of antioxidant enzymes are glutathione peroxidase, catalase, and superoxide dismutase. And of course, you know, antioxidant compound, vitamin A, C, E, and so on and so forth. So these are two components, and they work by different mechanisms. And the antioxidant had a complex mechanism, antioxidant compound, but the antioxidant enzyme is important because it catalyzes, for example, hydrogen peroxide and convert into water and oxygen without any problem. So there is no other mechanism involved. But antioxidant compound cannot do this kind of stuff. So both are synergistic to each other. So this has been there for a long time, as you know, throughout the human evolution. And then in the early 90s, endocannabinoid system was discovered in early 90s. And this was discovered because people who were smoking marijuana has some brain functional issue. And so scientists will become interested, what is going on here? Then suddenly they discovered, oh, it has a cannabinoid system. It has a receptor 1, receptor 2, and then all the enzymes that make it. So it was between 1990 and 2000, the entire cannabinoid system was identified. It consists of a ligand, natural ligand, lipid ligands, anandamide, and 2-AG. That's too long. Glycerol, I can't pronounce. That's too long. But there are two components. One is anandamide and also the 2-AG. And then they stimulate the receptors, there is a cannabinoid receptor 1, cannabinoid receptor 2. And so all the action of cannabinoid system and anandamide, when they get activated, and then the receptor affects, for example, serotonin receptor. They will stimulate serotonin receptor. So you have a high level of serotonin in your brain. And then you feel less anxiety, less problem. And also receptor increases the dopamine level. So you feel happy about it. Because in brain you have a dopamine, you feel happy about it. Another very important thing that endocannabinoid system does, that it prevents the release of glutamate. Because if excessive amount of glutamate is released, then you become hyperactive. Like you see the people who have ADHD or the spectrum of autism spectrum, and they have this kind of glutamate excessive amount is being released. And so how they complement each other, this is one case here, that one is released, but how about already accumulated glutamate? That is not doing, cannabinoid system can't do anything. But antioxidant protects the nerve cell against glutamate-induced toxicity. So you see that those two things work very well. So the question always is that how do you stimulate endocannabinoid system? We know how to do what you call antioxidant system by activating, say, NERV2. You use antioxidant enzymes, and then from the diet we get all this antioxidant compound. So we know how to things there. But to stimulate the endocannabinoid system, one physiological substances which is non-toxic is CBD. CBD will stimulate anandamide, stimulate the 2-AG, and also through them activation of receptor. But also CBD has a direct effect. For example, it acts as an inhibitor of serotonin reuptake. And prescription drug for anxiety right now is the inhibitor of serotonin uptake. But prescription drug causes toxicity also. This helps also people get benefit, but long-term it could have side effect as well. But CBD does exactly same thing without any toxicity. So this is very important to remember. And CBD also directly stimulates many other receptors, and then which antioxidant can do it. And so you can see that by both using the receptor system and antioxidant system, you can have the optimal benefit for your health and prevention of any kind of chronic health issue.
So I want to back up for the people on this call. Dr. Prasad's body of work really is a multi-micronutrient approach.
Yes.
And that's what makes him very unique compared to all the other antioxidant papers out there. And so it makes it, and he has many of them on one formula. And so that deals with the antioxidant defense system. And then when we look at the endocannabinoid system and how they crosstalk, he had actually, in our product line, he had provided a very pure CBD that we would be able to use. And we use that with patients, and it's an excellent product. But the endocannabinoid system crosstalks, they talk to each other, and they have different roles in our defense system, and they're lipid based. So as we segue into the omega-3 product, higher up is essential fats and how their role in the endocannabinoid system. And now you have provided a masterfully crafted. Oh, I'm so sorry. My phone, I'm sorry, everyone. My phone is off. It went through my computer. Okay. So I apologize. It's off.
No,
I'm sorry, everyone. I totally lost my train of thought.
Endocannabinoids
Yeah.
and
Yeah.
omegas.
Yeah, the
Yeah.
omega-3s. And so when we come back and it's masterfully made, we need to have building blocks to be so that our body has them available for this endocannabinoid system. And I shared a paper with Dr. Prasad about 6 months ago, and he has delivered this paper. But I wanted to segue into that the omega-3s and the essential fats are so important, right, for that endocannabinoid system.
yes.
And we'll segue. Do you want to talk a little bit about that?
Yes, I think endocannabinoid, this is very interesting that the fatty acids, essential fatty acid like omega-3 fatty acids, act as a, for example, act almost like a ligand that we have, which stimulates cannabinoid receptor, namely anandamide and 2-AG. These are two ligands. So almost the essential fatty acid means omega-3, especially omega-3 fatty acids, all mimic the effect of anandamide and DG. So it is a natural way of stimulating your endocannabinoid system so that they remain in a harmony with the antioxidant defense system and they work together. CBD was discovered later on. Not many people had access of CBD. So the question was how these things were working throughout the evolution. And the way it was working, because people were taking the omega-3 fatty acid, which acts as almost like a CBD in terms of stimulating the endocannabinoid system, and therefore people had a good time in maintaining healthy lifestyle. Those who had a sufficient amount of omega-3 fatty acid, and as you know, American diet has a ratio of 1 to 10. In other words, 1 part is omega-3 and 10 part is omega-6. Omega-6 is also very essential fatty acids, but it has a double function. In a small doses, it acts as an anti-inflammation. In high doses, it acts as a pro-inflammation. So if you have pro-inflammation, you will have a lot of chronic health issue. And therefore, and if you have anti-inflammation, you have a reduced amount of health issue as you grow older. So omega-3 fatty acids turn out is extremely much more important than initially people thought that it might be. I mean, essential fatty acid is okay, and our body do not make it. And therefore, and you say that, well, I will, from a vegetable, you get a alpha-linolic acid. You don't get a DHA or EPA from a vegetarian diet, but alpha-alanine, alpha-ALA convert very gradually to DHA. So its conversion rate is extremely slow and very minimal. So those who wants to take it, don't like fish to eat, for example, then omega-3 daily is a perfect one, is highly purified, and the ratio is 2 to 1 is extremely important because brain wants to have a high level. 40%, because brain has a lot of membranous structure, a lot of receptors, and they all need DHA to make it, new formation of new receptor. That's why brain has a 40% of the fatty acid, essential fatty acid in the brain is DHA, which is from the fish, like we have in omega-3, 2 to 1 ratio. And so it's very interesting. Is native of Alaska, Eskimos in old days, who were living a lot of fish, as you know, their ratio was 1 to 1. And so they had an incidence of chronic diseases in Eskimos was very little. And so it is very important.
You know, I remember 25 years ago having a conversation with one of my professors, Dan Murphy, and we were talking about the omega-6, omega-3 ratio at 4 to 1, omega-6 over omega-3. And he was throwing up his hands at that point.
And he was very upset.
And he was very upset about it. And, you know, can you share with us, I don't know if everybody knows why this omega-6 is not good. And you had said, we need it in small ratio, but in high ratios, it actually creates inflammation.
Yes.
What kind of foods do we find omega-6 in?
Well, any diet, like any kind of diet that Western diet you have, I guess, you eat a lot of fat,
Potato chips.
non-essential fatty acids.
Chips, corn chips,
Or
Doritos,
any
French fries.
junk food.
French fries. Oh my gosh, that's a big one. Everybody is like pulling their hair out. Look, I've already done it. It's all the stuff that we use as comfort food.
Yes, comfort food is correct expression.
And that's why the fact that this actually fills some of the receptors for the cannabinoid network, it helps to mellow you out a little bit so that you're not so stressed about not having your chips in case.
Yeah.
Okay. Okay. I want to show a graphic real quick, Dr. Prasad, for people to understand so if you're omega-3 deficient, what kinds of dis-ease in the body. And then I want to we'll get into a couple things, but I think that it's always a good visual of and then also why is our product different? Why is this? How did you make it different, and why it's different than other products on the market? So let me pull this graphic up. I've shown this the last 2 weeks, and you know what? I don't think anybody gets tired of looking at it.
No, I mean, you name the disease and it is there. Deficiency will cause it because it is essential. So anything which is essential, you don't give your body, then you have a problem.
So I put this up for people to be able to think about when you're deficient in omega-3s, you can have arthritis, a lot of cardiovascular diseases, adult and childhood ADD and ADHD, skin disorders, eczema, dry skin rashes. So we have Alzheimer's disease, memory loss, obesity is a big one. And I think that imbalance of the omega-6 to omega-3, once we get that balance corrected, a lot of people are going to just feel better and start leaning out because of that fat ratio is corrected. Excessive earwax, Dr. Prasad, is a telltale sign of excessive of omega-3 deficiency. It's not on here. I'm just telling you. I said it last week. And then we have, of course, macular degeneration, but that would be really particular to the DHA in the formulation. And then we have dry eye. So if you know people that have a lot of dry eye, ocular pressure, that's directly connected. Prematurity, aging, postpartum depression, cancer, asthma and allergies, anxiety, depression, bipolar, fibromyalgia. And basically,
diabetes is not on that.
I know, and you know what? I'm actually going to share a little snippet. When I went through your formula, I wanted to share some little special tidbits that I found along the way that I think why your product is so masterfully made. Jeff, would you mind please pulling up the label of the Omega Daily, please?
Absolutely.
Thank you.
Do you want me to just reduce you two others so that it's the full screen?
Sure.
Yeah.
Yes, please.
So that we can walk through with everybody. There we go. Perfect.
So there you go.
So Dr. Prasad, would you mind walking us through why you put the vitamin E as D alpha, and how do you say that?
Tocopherol.
Tocopherol.
Yeah.
So why did you put this form of vitamin E in 20.1 milligrams for this Omega Daily?
Yeah, as you know, the vitamin E acts as an antioxidant, and alpha tocopherol is the form body uses it. But in our preparation, for example, micro daily, they have acetate and or succinate form. But body has an enzyme which can remove those things, and body will use alpha tocopherol form. And D refers that it is derived from the natural sources, not synthetic one. And if it is a DL, if you see some formulation as a DL, that means it is a synthetic vitamin E. And if you say D-alpha tocopherol, that means it is from the it is a natural vitamin E. So that's one. Why we added? Because this is in a lipid environment, this omega daily can be oxidized in the presence of light and therefore prevent the oxidation so that your shelf life is remain very high for a long time. We have added vitamin E, has no role in terms of fatty acid. It has simply role to prevent the oxidation of these products which we have, and so that your shelf life lasts longer.
And then, and so the difference between the vitamin E succinate that you discovered and then another form of vitamin E, those have so that I understand, those have enzymes that can break them down.
Right, body has enzyme to break out the succinate or use vitamin E succinate as a unique vitamin E. And so that's why, but in a vitro system, like in a capsule, there's no enzyme system to do it. So that's the reason we put the alpha tocopherol form. Which
so that is very unique to many
Yes.
products. We've looked
Yes.
at lots of products and we measure a comprehensive omega panel. So
Yeah.
that makes it very unique. So it's not going to be rancid. Number
Right.
one, then the next part is the wild caught sustainable omega-3 fish, with two different sources. But then so that is 1,250 milligrams. But then out of the 1,250 milligrams, it's 250 milligrams of the EPA.
Uh-huh.
And that is, Dr. Prasad, from what I understand, really dealing more with circulatory and inflammatory type of issues.
Yeah, in this case, EPA DHA has even in high dose, it doesn't have a pro-inflammatory. It is only gamma linolenic acid or GLA has that problem. And so we gave a ratio. You can see that DHA and EPA has a ratio of 2:1. DHA has two times more than EPA. And these two comes from the fish. And the rest of the fish oil has could be some other
Properties.
acids. But
Okay. So like with the DHA, you had already gone over for people to understand 40% goal.
Yes.
Would you mind explaining why you made that 50% to the 2:1 with DHA being the two part? Why did you get it? Why did you choose that ratio?
because this ratio people have tried in human clinical study and has been found that it is most effective in terms of improving your brain function. And because brain needs a higher level of DHA, and this is sufficient amount that brain can accumulate it, because you are not going to give just one dose. You are giving every day and slowly. And since DHA is much higher than EPA, and EPA has some unique function of its own, and so like especially for cardiac, for heart disease or heart function, and so 2:1 ratio. The only reason I gave it, because first your brain requires more than EPA, and second that it was done in human study, has no toxicity, and therefore I added that.
Excellent. And a lot of people out in the marketplace, they just say they'll take high EPA, for cardiovascular issues, or just DHA for eye health or for brain health. So it's really important that he put this combination of the two.
Right,
issue.
exactly.
And
Because it both have some unique function of their own, and therefore a combination is very important.
and also a high amount of DHA is in your eye. And so that with the eye health, that's right.
Exactly. And so I think it as you saw in a graph that you showed it, this can cause many diseases. But then don't get the impression that if you just take a omega-3, your all health problem is resolved. No, this plays a part in all these diseases that you mentioned. That by itself, even if you correct the deficiency, because when you have you have a deficiency of omega-3 fatty acid or DHA, then you have deficiency probably other organ, because people did not measure it. So in other words, don't get the impression that if you just take omega-3, all the deficiency causing diseases will be restored. You have to have a multiple approach. This contributes, the deficiency contributes to that you have a deficiency of serious, because this is essential amino fatty acid. If you don't have if you don't have vitamin E deficiency, you will have a specific disease because it is important for certain aspect. But if you have deficiency of essential fatty acid, which every cell in the organ in your body uses it, you will have wide spectrum of diseases. But if you just correct this, but don't take care of other things, don't take care of oxidative stress, they will get damaged again. Suppose you form a new receptor because you provided this one, but what happens? Other things that are happening in your body increase oxidative stress and inflammation, they will be damaging again.
Right.
So correcting deficiency is extremely important so that they remain in a normal, healthy state, and then you protect them from our micronutrient and all the four products that we have recommended for optimal health and for long life with healthy lifestyle. And so this is very important to remember that one approach will not be sufficient for your need, prolonged lifespan with a minimal risk of health. And so you want to have a good life with good quality of life and long life, like mine. I mean, I surpass average age of Americans.
Yeah.
And sharp as a tack. And I'm actually going to give a specific to that. I've got 2 examples here, but we're going to finish the formulation. Then I'm actually going to tie a couple of those together. And I'm so excited to share that. I think it's going to help a lot of people on the call. I hope it does. So let's talk about why you put the borage oil, the GLA.
Because the GLA is derived from the borage oil because that's very rich oil. And so, but from there, even though they have 150 milligrams, they have some other types of fatty acid, but GLA is only 30 milligrams. So this oil, borage oil, is kind of seed, even though it has 150 milligrams listed there, but for 150 milligrams, only 30 milligrams is the GLA. So those things you need, GLA is only 30 milligrams. That is what our interest is. And this low dose will act as a anti-inflammation rather than pro-inflammation.
And then we also have, lastly, the organic flaxseed oil, where you actually, which is 200 milligrams, but of that 100 is ALA, which is
because ALA also has unique function, especially for heart disease. And so we said that you should have ALA as well. And from the diet, vegetarian diet, most of you get is ALA, alpha-linolenic acid, which again very slowly get converted to DHA.
So a couple things here. This is such a beautiful, masterfully made product for you on the market. Dr. Cord, have you seen anything that has the 2-to-1 ratio, the vitamin E, and then a plant-based omega-6 and a plant-based omega-3? Have you seen like this on the market?
There's nothing on the market like this. I've never seen anything like this. And, my head is spinning as I'm sitting here listening to you. I've got a million questions and not enough time. But, it is, I noticed a difference within the first couple of capsules that I took. I noticed a real clarity in my head. And I've also noticed a clarity in my vision.
Mm-hmm.
So I find myself, putting my glasses up on my head a lot more because I can still read, and I don't need to have, my glasses on my head.
That's good.
Now I'm looking for my glasses, which fortunately my memory is strong, so I can usually.
So I'm gonna talk about a couple of things on the formulation. So Jeff, it's okay, you don't have to put it back up, but these are some good tidbits. So first of all, Dr. Prasad's has a patent for the treatment of type 2 diabetes with our multi-micronutrient formulation.
Yes.
And it is an excellent product. And we have seen so many people, balance that blood sugar within like the first 90 days because every blood cell is brand new. So that's a very important fact that GLA is also being used in diabetes research. So that's going to be synergistic.
Yes.
That approach.
Yeah.
But But what happens when you have high blood sugar and you're taking ALA, which is omega-3 and from the flaxseed, and it'll slowly, it will convert to DHA, not efficiently.
No.
But what happens when you have high blood sugar, it actually blocks the body's ability to make DHA.
Hmm.
Okay. And so that combination of the multi-micronutrient of Dr. Prasad's, formulation, that's a patent for the treatment of type 2 diabetes, with this masterfully made product, you're going to be able to have the help of the GLA and then actually allow the ALA to do its job. And I think before, when people have high blood sugar and maybe taking flaxseed and doing our plant-based diet, they're not actually getting that conversion, which I think that's how the synergy of Dr. Prasad's work. It's just beautiful, Dr. Prasad. I'm so proud of you.
That's good.
And then one of the things that we brought up, because we have someone we're consulting with, another ALS patient, and I was doing work preparing for our call with you on how important omega-3s are, and we just now have been able to really start to measure the difference. The actual lab work is now really more efficient, and it wasn't there. Like, they just discovered the endocannabinoid system just 20 years ago, right? 25 years ago. But with that, we found that the deficiency of ALA is directly linked to ALS. That's some of the latest research. So for people on here, it's really important that he put all of these pieces in here. But like he said, the multi-micronutrient product to help balance the blood sugar with this omega-3 is just essential, right, Dr. Port?
It is. And it's also essential that don't rely on just the nutrients to change your health. We're control of every bite that we take. So we live and die one bite at a time. If you're sitting there with your bag of chips, realize the chips are 6 and they're not.
Right.
Well, we have an interesting case study. It was a 3-year case study of ours.
Oh, this is fascinating.
And I measure many things on this, like EEG, sleep, cognition, balance, gait, whatever, lots of labs. And he really worked hard, and he got rid of gluten and dairy and just worked hard on his diet. But guess what he ate every day, Dr. Prasad? Chips.
Corn chips.
Corn chips.
And his number one hypersensitivity? Corn. And then potatoes. So we'd taken him off all the things that we thought were a problem. But then when we did our final testing, we started looking at things that his body was sensitive to. We had to take him off those. And then he started to really turn the corner. And it was a very important case.
Well, and we measured his omega-3s, and they were very imbalanced.
Yeah.
Okay. But what's so exciting for everybody on here is that and this is one of the things that makes this product unique, is that it also is a twice-a-day dose. And that's Dr. Prasad's work. So it's not just a multi-micronutrient formulation, okay, that reduces oxidative stress and inflammation simultaneously. No other product does that, but it's a twice-a-day dose.
Yeah.
And it really, all of his research was based off of that dose. And with the omega-3, I just know that taking it with your first meal and your last meal, that people are going to start sleeping better, less joint pain. They're going to have better cognition.
Yes.
They're going to have eye health.
Restorative sleep. It helps to calm the brain. So
calm the brain
like
down.
the CBD that we took at night, the omegas actually help to calm the brain so that we can get into restorative sleep.
Yeah.
It's incredible.
So anyhow, so we're going to segue to the core 4, Jeff. But Dr. Prasad, is there anything else that we didn't mention about your Omega Daily product? I know in your textbooks, and you've always mentioned in your textbooks at least 1,000 milligrams of an omega-3 for most diseases. And these are textbooks that are being taught for PhDs or medical doctors. And I mean, he's done that for a long time. Is there anything that you want to really share about the omega-3 for people to understand why you made it the way you did and why it's an important part of the core 4?
Yeah, but for core 4 is very important. But first, sometimes people use one agent for omega-3, say, for example, formulation, and they put a lot of omega-3. But that's not enough for your health. We have 4 approaches, multiple approaches. One approach is obviously micronutrient, number 1, which reduces oxidative stress and inflammation that initiate all your poor health issue. Then we have a second best one is the gut health. The gut health is important because as you grow older, with or without any disease, the flora changes in favor of toxic bacteria. And toxic bacteria produces a lot of pro-inflammatory cytokines and other toxic chemicals, which will be absorbed and gradually affects all your organ and all increase the risk of many diseases. And that's why when they measure in the patient with diabetes or Alzheimer or Parkinson or any disease, when they measure the intestinal flora, they always found that the toxic ratio of the harmful bacteria increases. So how you balance that? Probiotics, which has all beneficial bacteria. Yes.
Dr. Prasad, also, and I don't mean to interrupt you, but I think this might be helpful.
Yes.
In the standard American diet and in, now European diets and so forth, there's meat. And it is without question that the meat, no matter what kind of meat it is being injected with antibiotics.
Yes.
And those antibiotics then kill our natural gut flora. Would you agree?
Yes, definitely. And that's why, there are 2 issues when you take excessive amount of meat. 2 issues. If you highly protein, they say, well, I need a protein. If you take a highly rich protein, then the branch amino acid protein increases. And then what happens that they increases the risk of diabetes. So extremely rich, which only you can get from the meat. If you take balanced amount, this will be okay. Sometimes you can buy it, which is antibiotics free. At least they claim it is antibiotics free. But so even if you take a protein from the animal sources, meat sources, make sure it is a balanced amount, not the excessive amount. Another thing is, as you know, meat eaters forms more chemical carcinogen or mutagens in the gut during digestion than, say, vegetarian. So, but if you take antioxidant, then they don't form it. But point I'm trying to say that whatever you do, I'm not saying that you should not eat meat, but I'm saying that don't eat excessive amount of meat as well.
Well, and it's true with dairy. I actually saw a cow once that had milk fever, and I watched the veterinarian pump in a giant caulking tube of antibiotics and a giant caulking tube of another anti-inflammatory. And then we came back later in the afternoon and he did it again. And then we did it the next morning and the cow stood up and away you go. And so even in our milk products, there's antibiotics in our milk products, antibiotics in our meat.
That's unfortunate, but.
So try to get back.
So when they say, take yogurt, you get an antibiotic at the doctor and the doctor says, take yogurt. Well, the yogurt's got antibiotics in it.
Yeah, not only antibiotics is there, but yogurt has mostly bifido and lactobacillus type of bacteria. So when you go to the acid environment, they get destroyed, 60-70% of them. So, but if you eat every day, which nobody does it, then it might be of some value. That's why in our probiotic product, we had it 2. One is Bacillus coagulant, which is FDA approved probiotic to be given in an infant formula, because infants are very sterile, their gut is very sterile, so they'll make sure no toxic bacteria forms colony there. And also Saccharomyces boulardii, which is yeast-derived probiotics, but has been tested in human in intestinal inflammatory bowel syndrome, and it's non-toxic, it's very effective. And these 2, one is derived from the soil. That's why many people, people who, like if you're a baby and tends to eat soil sometimes, maybe this is good for their immune system because they get also bacillus coagulant. But anyway, these two, since they are not naturally there, they get eliminated from your gut in 5 days. That's why it is important to take every day, because they are not going to stay there for like lactobacillus and bifidobacteria, bacteria, they stay forever once they form the colony.
And the latter of the two protect from the acid environment.
Yes, because they are very acid resistant, and also they are heat resistant. So both, and that's why it is so effective. My wife, as I told you earlier, my wife and daughter-in-law had some intestinal problem, and they were doctor recommended probiotics, different types of probiotics. They had some effect. In my wife's case, it was a bacillus coagulant, and just alone. So it was some effect, but when they took our formulation probiotics, both of them are extremely happy that they solved this problem.
I think the next most important product is the omega.
Next, third, out of 4, the first is microdaily EMF capsule or hydro, whatever you prefer. If you have acute case, I always recommend hydro. And then, of course, probiotics. And the third important component is omega-3 daily, because this is so important. It is, anything which is essential for your survival, you must have it.
It's essential.
Yeah, absolutely essential. Just like antioxidant is extremely essential. And so, but I don't know. So these 3, and then 4th one is these collagen peptides, because it is not make you younger and so on and so forth, but also has implication at least in diabetes, and also most likely in human data they have tested, it is sure for diabetes type 2, and also in a experimental data show it could have an impact in reducing the risk of Alzheimer, at least the progression it, because collagen peptide collagen peptide number 6 binds with the amyloid protein, which is a toxic protein that causes damage to your nerve cell that then you forget. And so, and if you bind it, then it becomes inactive. They can't damage the cell. So human trial has not been done. And all. So it is important. So these 4 are unique to your long life, as well as long and healthy, excellent quality of life.
And for everyone on here, each one of these products, the micro daily EMF and EMF hydro, the collagen peptides, which also have enzyme inhibitors that make them very unique.
That's unique.
That's very unique. And then the probiotic daily is very unique. It also has the prebiotics, the food.
Yeah, this is important, very important. Prebiotics, extremely. Without prebiotics, bacteria has no food because they ferment it. And during fermentation process, short-chain fatty acid like butyric acid is produced. You know, when I published the paper in 1980, there was no single paper was out, butyric acid, except mine. And now you go in a PubMed, it will live more than 500 paper. Not only it is anti-cancer agent, but it has a function, immune function, in neurological disease, all kind of health issue.
And that's a short chain fatty acid. And
short-chain fatty acid is 4 carbon fatty acids.
Mm-hmm.
And
then the last one, the omega-3 daily. All 4 of these products are all patent pending.
Yes.
And what does that mean? Okay, for anybody on this call, our original micro daily product is patented.
Yes.
Patented product. And for people to understand, I think the biggest thing is that so many products are out on the market, and not very many of them, well, none that I know of, have the research as our flagship micro daily product. It's just not out there, proven to reduce oxidative stress and inflammation simultaneously, and help with glutamate, excessive glutamate and glutamate toxicity. There's not anything out there. But the rest of our products to be patent pending, Dr. Prasad, that's novel. That means they're unique, because most things out there are me too, and they don't have any reason to patent them.
Yeah,
because there's nothing unique or special about
yeah,
them.
exactly.
And so when you
exactly.
start looking at Dr. Prasad's body of work and the research, but then you look at the patent pending on each individual product, that's really unique.
Yeah.
You know, I have a question,
Sure.
and then we'll probably wrap this up.
Mhm.
But you have to have been thinking about this omega product for decades.
Yeah.
How long has it been gnawing at you to reel in this fish and create this product?
I mean, it took a long time, but sometimes it is a business decision. But as you know, the discovery of omega-3, we have been taking this forever during entire evolution, million years. But it was discovered, omega-6 was first discovered in 1929. And in 1970 and 80, omega-3 was identified. It is important. It is so weird research because fatty acid, nobody cares about it, And finally, they found out the deficiency that Janet you mentioned, and they say, oh, maybe it is important.
Well, after World War II, we started having freeze foods, and in the 70s is really when a lot of these packaged foods that are created,
that's really changed everything.
Really came out.
Yeah.
And so, this is within our lifetime, and certainly within your lifetime.
Yes, definitely.
This really critical, important product of the omega-3 daily was developed. The concept of coming up with multiple oils, is that something that you've always played with, or is that something in the last 5 or 10 years that you've said, I'm going to do this, and when the time comes?
Yeah, I think, because omega-3 was always of interest to me, but never emphasized much because there were so many other things I was doing it. And also that, it was a business decision too, because it costs money to market it. Finally, David Navalka said, well, I think now it is the right time to do it.
It sort of feels like a crown jewel,
Yeah.
And for people on this call, we only had the Micro Daily Original. That's all we had for years. We had only one product.
Yeah, it went for a long time, yeah. And people get it benefit. So again, one approach can have some benefit better than a single antioxidant. But then we became aware. I was telling you that Hippocrates, did I pronounce correctly?
Hippocrates, yes.
Close. Yeah.
Hippocrates. He 25 years ago, he stated in quote that all human diseases begins in the gut. At that time, there was no knowledge of microbiome, intestinal bacteria, or anything. But he was a smart, not only physician, he was a smart philosopher.
He also said, before you ask me to get you well, what are you willing to give up that made you sick in the first place? So that's pretty amazing as well.
Yeah, that's amazing.
I found a disc of you and I lecturing in 2020.
Yes.
When we lectured in Oregon, and I showed we were moving, and I showed it to Jonette the other day. I'm like, look.
Yeah, I think we were from the same platform there.
You and I standing on stage.
Yeah, that was fun.
What amazing times. So many things have happened in the last 3 years.
Yeah, exactly.
Well, and I think that a lot has happened in our world in the, with COVID and the pandemic and
And also the company was doing, sometimes product development also depend upon the financial availability. And so I think David Navalka felt comfortable because it was doing so well that he can develop new product. And last product will be, I wouldn't say last product, but the overall health, his last product would be inaugurated in Cancun.
Mm-hmm.
Excellent.
It's going to be fun. Well, I think it's time to tell the people that get back to the person that put you on this call. It is so critical. What else?
Well, get back to the person that invited you to get on this call and to say, are you ready to get started? And those core four, they actually got the price down to under $200.
Yes.
And I want you to know, how much money did you spend like when you went to the ER? Like if you have a trip to the ER, just real quickly.
Yeah, I went to the ER thinking I was having a heart attack, and it was actually, I was sleeping in the same room as my router.
Right.
and it was affecting my heart. It was exact symptoms of a heart attack. But then after 3.5 hours, they said, nothing's wrong with you, but you might have some, deficiencies in Prilosec, and you need an antidepressant, and you need, to have some nitroglycerin. And they gave me all these things that they thought that I needed. And I said, I don't need any of those things because that's not the issue. And then they said, well, the issue is that you owe us $5,500 for 3 hours in the hospital.
Wow.
So I'm so grateful because it takes a lot for me to spend $5,500 in nutrients.
And I want for people, when you go to the ER, you guys, that's what it costs. So
Yeah.
let's prevent. This is prevention. And
Prevents, exactly.
And so we're going to end with this. You can be able to watch the Optimal Longevity series on YouTube, on Team Serve. So this will be there in a few days, and any of our other Optimal Longevity series. But we just look at how sharp Dr. Prasad is. 88 plus.
Yep.
And still publishing, still.
Closer to 89 than he is to 88.
I'm calling it 88 plus. We're not
Plus,
going to plus. But we want to be sharp, right? And he gets to do his passion. And everybody on this call, it's just such a blessing to get to have you here, Dr. Prasad. This was a great call. I hope everybody learns some new things that they can be able to take out into the field and help your friends and family. And we know they will. We've been using it for over 8 years now, as a physician, and we've seen all kinds of products, and this is the best product line. And almost every one of them are patent pending, which means they're unique and special. And I know that they'll help you too. So if you guys want to unmute and thank Dr. Prasad, we can go ahead and wrap up the call.
One, I want to thank you, Dr. Prasad, for being here every Tuesday night with us at the same time for the Optimal Longevity series. And all of you on the call, please bring one more person next week so that we can make this the power call. And we're excited and blessed, and we always try and bring a high level and an understandable level.
Thank you, Dr. Prasad, and thank you, Dr. Clark. And
thank you, Dr. Prasad. Thank you,
Thank you.
Dr.
Thank you.
Dr.
Thank
Prasad.
you.
We appreciate you.
Appreciate it.
God bless you.
Dr. Court.
Awesome
thank
job.
you, Dr. Prasad.
Thank you, Dr.
Thank you
Court.
so much.
Thank you, Joanne.
Pretty
Thank you,
amazing.
everyone.
Have a great
week.
night and be well.
Yeah, you too, all of you.
Thanks,
Bye-bye.
Dr. Court.
So
Thanks,
glad to
Jeanette.
see you.
Thank
Thank
you.
you.
All right. God bless all of us. Everyone have a
God
good
bless
day.
all.
God bless
Amen.
everybody.
God
Yes,
bless.
hallelujah.
All right. Hey, Steph. Good to hear you.
All right.
Bye-bye
Very
now.
good tonight.
Very good tonight. All right.